Hello everyone, I'm Dr. Rachna Shanbag Moite, a pediatric immunologist and rheumatologist. On this occasion of World Primary Immunodeficiency Disease Awareness Week, which is celebrated every year from 22nd to 29th April, I'd like to take this opportunity to tell you something about these diseases. Before we understand what are primary immunodeficiency diseases, or what we call as PIDs, we must understand what is immunity. Especially after the corona pandemic, we are all aware of the term immunity. So what is immunity, or the immune system of our body? Our body is gifted with an inbuilt defense system. This defense system consists of several fighter cells, and the main job of these fighter cells is to protect our body from infections. These infections could be due to bacteria, viruses, fungus, parasites, etc. These cells of the immune system, or what we call as the immune warriors, are made up of cells like T cells, B cells, and certain other cells which we call as phagocytes. Now what do the T cells do? The T cells protect our body from viral infections and from tumor cells, whereas the B cells protect our body from bacterial infections, fungal infections, whereas the neutrophils, which we call as the phagocytic system of our body, helps in engulfing organisms and protects our body from intracellular pathogens such as mycobacterium, which causes tuberculosis. It is with the help of these cells like T cells, B cells and neutrophils that our body is protected from several infections. So now that we know what is the immunity of our body, let us move on to understanding what are primary immunodeficiency diseases. PID. P stands for primary. Primary meaning these are genetic disorders. What do we mean by genetic? Genetic disorders are disorders which are inherited through genes, and genes are the ones that we receive from our parents. So if there is a defect in the genes that encode for these various immune cells, this is what gives rise to primary immunodeficiency diseases. The defect in immunity might be in the production of these fighter cells. If these fighter cells are not produced in adequate numbers, they can predispose our body to develop infections. The defect can also be in the quality of these immune cells. If the cells are produced in adequate numbers but they are not functioning well, this can also give rise to a primary immunodeficiency disease. So having said that, how can one recognize these diseases in children or even adults? The Jeffrey Model Foundation has given 10 warning signs of PID. Let us go through them. So these warning signs include recurrent ear infections, serious sinus infections, recurrent or severe pneumonias requiring hospitalization, persistent oral thrush, or what we call as the fungal infection of the mouth or fungal infection of the skin. These individuals may develop deep-seated abscesses or abscesses of the skin. They may also develop infection of the blood, what we call as septicemia. Another warning sign is requirement of prolonged course of antibiotics to cure infections in these children. They may also require IV antibiotics for a prolonged period of time. Very important warning sign is present of family history of PID, meaning to say that there might be other individuals in the family who might have similar history of developing recurrent infections, or history of a sibling who might have died at a young age due to such infections. In such cases, one must definitely investigate the index child for underlying PID. And the 10th warning sign being failure to gain weight and height appropriate for age. If you see a child who's not growing adequately for age, not gaining weight and height due to recurrent infections, one must think of a PID in this condition. Having understood what are the warning signs of PIDs, let us now move on to how can we diagnose these conditions in such individuals. To diagnose these conditions, we have several tests available. To name a few, lymphocyte subset analysis, serum immunoglobulin levels, and for a definitive diagnosis, we also order a genetic test. And let me tell you friends, these tests are now readily available to all of us, hence making the diagnosis of PIDs much more easier in such individuals. So the obvious question remains, is there treatment available for these diseases? Yes, there is treatment available. Most of these children would be put on prophylactic antibiotics to prevent them from developing recurrent infections. Some of these children might also require IVIG, or what we call as intravenous immunoglobulin therapy, which is given on a monthly basis to help boost their immunity. And the definitive treatment in these cases remains a bone marrow transplant. And after undergoing a bone marrow transplant, in case of a successful BMT, these children continue to remain well off all medications and can live a normal life. I'm sure many of us might feel these are rare diseases. Do we see them regularly? Are they common among the general population? Let me tell you, the statistics tell us that 1 in 1200 individuals have an underlying primary immune deficiency disease. So they are not as rare as we think they are. It is the lack of awareness and knowledge about these diseases among the general population and the medical fraternity that most of these individuals remain undiagnosed and continue to suffer from recurrent infection. Children might have a very severe immune defect which can also cause death at a very young age. Therefore, recognizing these diseases in time, diagnosing them and providing timely treatment becomes extremely important. So friends, the theme for this year's PID Awareness Week is access to care for all PID patients everywhere. So I hope with the help of this video, we are now more aware of these diseases and we will be able to recognize these children or individuals who come to us with recurrent infections, screen them and diagnose them so that they can receive treatment in time. Thank you.